Quinine sulfate is a medication used to treat malaria, which is a disease caused by mosquito bites in countries where malaria is common. Malaria parasites can enter the body through these mosquito bites and then live in body tissues such as red blood cells or the liver. Quinine sulfate works by killing the malaria parasites living inside red blood cells. In some cases, another medication may be needed to kill the malaria parasites living in other body tissues. Both drugs may be needed for a complete cure and to prevent the return of infection. It's important to discuss the most recent information with your doctor before traveling to areas where malaria occurs. As for the daily dosage and timing, it's important to follow your doctor's instructions. Usually, quinine sulfate is taken with food to help reduce stomach upset. It's important to take it at the same time each day to maintain a consistent level of the medication in your body. Remember, quinine sulfate is not used for the prevention of malaria. Before taking quinine sulfate, make sure to read the medication guide and the patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with food as directed by your doctor, usually every 8 hours for 3 to 7 days. Take it 2 to 3 hours before or after taking antacids containing aluminum or magnesium. The dosage and length of treatment are based on your medical condition, country where you were infected, other medications you may be taking for malaria, and your response to treatment. For children, the dosage is also based on weight. Continue taking this medication exactly as prescribed by your doctor. Do not take more or less of this drug than prescribed. Do not skip any doses. Take it at the same times each day to keep the amount of drug in your body at a constant level. If you do not start feeling better after 1 to 2 days of starting this medication, or if your fever returns after completing this prescription, contact your doctor. Side effects of quinine sulfate may include mild headache, flushing, sweating, nausea, ringing in the ears, decreased hearing, dizziness, blurred vision, and temporary changes in color vision. If any of these effects persist after treatment or worsen, consult your doctor or pharmacist immediately. Quinine may cause low blood sugar, especially during pregnancy. Symptoms of low blood sugar include sudden sweating, shaking, fast heartbeat, hunger, blurred vision, dizziness, or tingling hands/feet. If you experience these symptoms, increase your blood sugar by eating a quick source of sugar or drinking fruit juice or non-diet soda. Notify your doctor about the reaction and the use of this product. Remember, this medication has been prescribed because the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Contact your doctor immediately if you experience any serious side effects, such as easy bruising/bleeding, unusual purple/brown/red spots on the skin, signs of serious infection, signs of sudden loss of red blood cells, signs of severe liver problems, signs of kidney problems, chest pain, severe dizziness, fainting, fast/irregular heartbeat, or blindness. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects. If you notice other effects not listed, contact your doctor or pharmacist. The FDA warns against using quinine to treat leg cramps as it has not been proven effective for this purpose and may cause serious side effects. It is important to consult with your doctor or pharmacist for more information. However, quinine sulfate is still used to treat certain types of malaria and is sometimes used off-label to treat other conditions such as nocturnal leg cramps. It works by killing the malaria parasite or by reducing the frequency and severity of leg cramps. The typical dosage for malaria is 648 mg every 8 hours for 7 days, while the dosage for leg cramps varies and should be discussed with a healthcare professional. Quinine sulfate is usually taken with food to help reduce stomach upset. It is important to take it at the same time each day to maintain a consistent level in your body. Be sure to follow your doctor's instructions carefully and do not exceed the recommended dosage. Before taking quinine sulfate, make sure to inform your doctor or pharmacist if you are allergic to it, quinidine, mefloquine, or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems. It's important to share your medical history with your doctor or pharmacist, especially if you have had serious side effects with quinine, a certain enzyme problem, eye nerve problem, hearing problems, nerve/muscle disease, heart rhythm problems, kidney problems, or liver problems. Quinine sulfate may cause dizziness or blurry vision. Avoid alcohol or marijuana as they can increase these effects. It's best to avoid activities that require alertness or clear vision until you can do them safely. Also, discuss the use of marijuana with your doctor. Inform your doctor or dentist about all the products you use before having surgery, including prescription drugs, non-prescription drugs, and herbal products. Quinine sulfate may affect the heart rhythm, leading to serious and potentially fatal symptoms. The risk of this condition may increase if you have certain medical conditions or are taking other drugs that may cause heart rhythm problems. Be sure to discuss your medical history and all the drugs you are taking with your doctor. Low levels of potassium or magnesium in the blood may also increase your risk of heart rhythm problems. Talk to your doctor about using quinine sulfate safely, especially if you are using certain drugs or experiencing conditions such as severe sweating, diarrhea, or vomiting. If you are an older adult, you may be more sensitive to the side effects of this drug, especially heart rhythm problems. During pregnancy, use this medication only if clearly needed and after discussing the risks, benefits, and treatment options with your doctor. Untreated malaria is a serious condition that can harm both a pregnant woman and her unborn baby. Quinine sulfate passes into breast milk, but it is unlikely to harm some nursing infants. Your doctor will test your infant for a certain enzyme deficiency before you breastfeed. Always consult your doctor before breastfeeding. When taking quinine sulfate, it's important to be aware of potential interactions with other medications. This includes blood thinners, penicillamine, cimetidine, erythromycin, ketoconazole, phenytoin, rifampin, HIV protease inhibitors, ritonavir, urinary alkalinizers, desipramine, digoxin, certain statin drugs, phenobarbital, amiodarone, dofetilide, mefloquine, pymazide, procainamide, quinidine, sotalol, and macrolide antibiotics. It's crucial to inform your doctor or pharmacist of all the medications you are currently using. Additionally, it's important to avoid using medications containing quinidine while using quinine. Furthermore, quinine sulfate may interfere with certain lab tests, potentially causing false test results. Be sure to inform lab personnel and your doctors that you are using this medication. Remember, it's essential to keep a list of all the products you use and share it with your doctor and pharmacist. It's also important to not start, stop, or change the dosage of any medicines without your doctor's approval. If you suspect an overdose or experience serious symptoms like passing out or difficulty breathing, seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, contact a provincial poison control center. Symptoms of overdose may include sudden vision changes, confusion, severe trouble hearing, fast or irregular heartbeat, fainting, slow or shallow breathing, seizures, and inability to wake up, coma. It's important not to share your prescribed quinine sulfate with anyone else. Your doctor may also order various medical tests while you're taking this medication, such as blood level tests, vision tests, blood potassium tests, and tests to check your liver, kidney function, and EKG. Make sure to keep all of your scheduled medical and lab appointments, and consult your doctor for more information. If you forget to take a dose of quinine sulfate, take it as soon as you remember. If it has been more than 4 hours since the missed dose, then skip it and take the next dose at the usual time. Do not take a double dose to make up for the missed one. It's important to store quinine sulfate at room temperature, away from light and moisture. Make sure not to keep it in the bathroom, and always keep it out of reach of children and pets. When it comes to disposing of quinine sulfate, be sure not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. It's best to consult your pharmacist or local waste disposal company for the proper way to dispose of it. As for the best time to take quinine sulfate, it's important to follow your doctor's instructions. Typically, it is taken with a full glass of water after a meal or snack to minimize stomach upset. The dosage and frequency of taking quinine sulfate will depend on your medical condition and response to the treatment, so be sure to follow your doctor's guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.